Struggling to walk after 60? Do this stretch to move freely in 14 days. Do you find yourself taking smaller, more hesitant steps than you used to? Does that familiar ache in your hips or knees make a simple walk around the block feel like a monumental task? Perhaps you worry about your balance, feeling less steady on your feet, or even avoiding activities you once loved just to prevent a fall. If this sounds familiar, you are absolutely not alone. For many of us over 60, experiencing difficulties with walking or a fear of losing our mobility can be deeply unsettling. It's more than just a minor inconvenience, isn't it? It's the risk of losing your independence, having to rely on others, and watching your quality of life diminish. But here's the genuinely good news, and it's a message of profound hope. You can absolutely turn this around. You can improve your walking ability, boost your balance, and reclaim your freedom of movement with simple, scientifically backed changes you can start implementing today. And I'm going to reveal one surprisingly simple stretch that has shown promising results in helping you move more freely in as little as 14 days. Before we dive into the actionable solutions, let's clear up a common misconception. Many people believe that struggling to walk, losing balance, and becoming less mobile are an unavoidable part of aging, something we just have to accept. Here's the thing. While some changes are natural as we get older, significant difficulties with walking and a high risk of falls are not inevitable. Often, these issues stem from a combination of factors such as muscle weakness, reduced flexibility, decreased balance, and sometimes, even inadequate footwear or poor hydration. Your body, especially your legs, hips, and core, is designed for movement. When these crucial muscle groups become tight or weak, or when your sense of balance diminishes, your gait, the way you walk, can change, becoming less efficient and more precarious. Think of it like a car with unbalanced tires and stiff steering. It's harder to control and can be prone to swerving. The good news is that by understanding and addressing these contributing factors, you have significant control over your mobility and walking confidence. This isn't about becoming a sprinter. It's about making smart, practical adjustments that allow you to move more freely, safely, and enjoy your golden years with comfort and independence. We're going to focus on easy-to-implement steps that genuinely make a difference in how you walk and how confident you feel doing it. Tip number 1. Do this stretch, the hip flexor stretch. Alright, prepare for an aha moment, because this is where we introduce a truly foundational stretch that can dramatically improve your walking ability. The hip flexor stretch. You might think that walking difficulties are all about your knees or ankles, but here's why your hip flexors are so crucial. These muscles, located at the front of your hips, often become tight from prolonged sitting, which many of us do. When your hip flexors are tight, they pull your pelvis forward, making it difficult for your hips to extend fully when you walk. This forces you to take shorter strides, put more strain on your lower back and knees, and makes your gait less efficient and more unstable. It's like trying to walk with a bungee cord tying your hips to your stomach. So, how do you do this stretch effectively and safely? It's surprisingly gentle. Kneeling hip flexor stretch. Use a mat or pillow for comfort. Kneel on one knee, e.g., your right knee, with your left foot flat on the floor in front of you, forming a 90-degree angle at your knee. Gently push your hips forward until you feel a stretch in the front of your right hip/thigh. Keep your back straight and core gently engaged. Hold for 20 to 30 seconds. Repeat 2 to 3 times on each side. Standing hip flexor stretch. Use a chair or wall for support. Stand tall. Take a small step forward with one foot. Gently bend your front knee and shift your weight slightly forward until you feel a stretch in the front of the back hip. Keep your back straight. Hold for 20 to 30 seconds. You'll be surprised how much more easily your leg swings through, how much longer your strides become, and how much less strain you feel in your lower back. Consistent practice of this stretch can lead to noticeable improvements in your walking comfort and fluidity in as little as 14 days. This fundamental stretch doesn't just help your walking, it improves your overall posture and reduces lower back pain. Tip number 2. Strengthen your core, your body's powerhouse. Now, let's move to another area that's absolutely critical for confident walking but often overlooked: strengthening your core muscles. You might think of core exercises as just for a six-pack, but here's the thing. Your core muscles, which include your abdominal muscles, lower back muscles, and hip muscles, are your body's powerhouse. They provide stability for your entire trunk, help maintain balance, and efficiently transfer power from your upper body to your lower body when you walk. A weak core means your legs and back have to work harder, leading to fatigue, instability, and a less efficient gait. It's like trying to walk on wobbly legs without a strong torso to steady you. So, how do you strengthen your core gently and effectively? You don't need to do sit-ups. Chair marches. Sit tall in a chair, feet flat on the floor. Gently lift one knee towards your chest, then lower it. Alternate legs, marching slowly and controlled. Aim for 10 to 15 repetitions on each side. Seated torso twists. Sit tall. Place your hands lightly behind your head or cross them over your chest. Gently twist your torso to one side, then to the other. Keep your hips stable. Aim for 10 to 15 twists to each side. Pelvic tilts. Lying down, lie on your back with knees bent, feet flat. Gently flatten your lower back into the floor by tilting your pelvis up slightly, then release. This engages your deep core muscles. You'll be surprised how much more stable and balanced you feel, and how much easier it is to control your movements when you walk. This habit doesn't just help your walking, it improves your posture, reduces back pain, and even helps prevent falls. Tip number 3. Practice your balance daily. Alright, here's where it gets really interesting and directly impacts your ability to walk confidently. Practicing your balance daily. Most people think balance is something you either have or you don't, and that it naturally declines with age. Here's the surprising fact. Balance is a skill that can be significantly improved with consistent practice, no matter your age. Poor balance is a major reason why walking becomes difficult and why falls are so common among seniors. Your brain needs to constantly receive information from your eyes, inner ear, and muscles to keep you upright. If these systems aren't challenged, they can become less efficient, leading to unsteadiness. It's like a finely tuned instrument that needs regular playing to stay in tune. So, how do you implement it? Integrate simple balance exercises into your daily routine. Standing on one leg, with support, start by holding onto a sturdy chair or kitchen counter. Lift one foot slightly off the floor and try to hold for 10 to 15 seconds. Gradually work up to 30 seconds. Repeat 2 to 3 times on each leg. As you get steadier, try doing it without holding on for short periods. Heel-to-toe walk. Walk in a straight line, placing the heel of your front foot directly in front of the toes of your back foot. This is great for challenging your stability and is a key exercise used in fall prevention programs. Tai Chi or yoga. These practices are excellent for improving balance, flexibility, and strength in a gentle, controlled manner. Many community centers offer classes tailored for seniors. Incorporate 5 to 10 minutes of balance training into your daily routine. You'll be surprised how much more stable and confident you feel on your feet in just a few weeks, which directly translates to more comfortable and secure walking. This habit doesn't just help your walking, it dramatically reduces your risk of falls and keeps you independent. And if you're finding this helpful, please give this video a like, subscribe to the channel, and turn on notifications so you don't miss our upcoming content. Also, tell us in the comments below, what's one place you'd love to walk more confidently? We'd love to hear from you. Tip number 4. The importance of proper footwear. Next up, let's talk about something incredibly practical that can make a huge difference in your walking comfort and stability: the importance of proper footwear. You might think any comfortable shoe will do, but here's the thing. Ill-fitting shoes, shoes with poor support, worn-out soles, or heels that are too high can significantly impact your gait, balance, and overall walking ability. Shoes that don't provide adequate cushioning can transmit more impact to your joints, leading to pain. Shoes that are too loose or too tight can cause blisters or alter the way you step, leading to instability. Worn-out soles can reduce traction, increasing your risk of slips and falls, especially on uneven surfaces. It's like trying to navigate a challenging path with faulty tires. So, how do you choose and maintain proper footwear? Support and stability. Look for shoes with good arch support and a firm heel counter, the back part of the shoe that cups your heel. Comfortable fit. Ensure there's enough room in the toe box and that the shoe doesn't pinch or rub anywhere. Try on shoes at the end of the day when your feet are slightly swollen. Low and wide heel. Avoid high heels or overly narrow heels. A broad, Stable heel is best for balance. Non-slip soles. Look for soles with good traction to prevent slips. Replace worn shoes. Don't hold onto shoes with worn-out soles or collapsed cushioning. Replace athletic shoes every 6 to 12 months depending on use. You'll be surprised how much more stable and comfortable your steps feel when your feet are properly supported. This habit doesn't just help your walking, it reduces joint pain in your feet, ankles, knees, and hips, and significantly lowers your risk of falls, keeping you moving freely for years. Tip number 5. Stay hydrated for joint and muscle health. Here's a crucial habit that affects not just your general health, but specifically your ability to walk freely, staying properly hydrated. We often think of hydration for energy or thirst, but here's the thing. Water is absolutely essential for the healthy function of your joints, muscles, and even your balance. Your joint cartilage, which acts as a cushion, is largely made of water. The synovial fluid, which lubricates your joints, also relies heavily on adequate hydration. When you're dehydrated, this fluid can become thicker and less effective, leading to increased stiffness and friction, making walking less smooth. Furthermore, dehydration can lead to muscle fatigue, cramps, and reduced coordination, all of which can impact your gait and increase the risk of falls. It's like trying to walk with a stiff, unoiled machine. So, how do you ensure you're getting enough water? Aim for 6 to 8 glasses, around 1.5 to 2 liters, of plain water daily, more if you're active or it's a warm day. Sip throughout the day. Don't try to chug it all at once. Keep a glass of water by your side and refill it often. Set reminders. Use a water bottle with time markings or set an alarm on your phone to remind you to drink. Infuse your water. If plain water is boring, add slices of lemon, cucumber, or a few berries for flavor. You'll be surprised how much more fluid and less stiff your joints feel, how much better your muscles perform, and how much more energy you have for walking. This habit doesn't just help your walking, it keeps your whole body functioning optimally, ensuring you stay mobile and comfortable for years. Tip number 6. Integrate regular, gentle walking. Now, this might seem obvious, but it's important to stress the power of regular, gentle walking itself. Most people think if walking is already difficult, they should avoid it. Here's the surprising truth. Consistent, gentle walking is one of the best ways to improve your ability to walk more freely. Your body adapts to what you ask of it. If you ask it to sit, it gets better at sitting. If you ask it to walk, it gets better at walking. Walking strengthens the muscles in your legs, hips, and core, improves your cardiovascular health, enhances circulation to your joints, and naturally practices your balance. It helps maintain the flexibility you gain from stretching and the stability from core work. It's like practicing an instrument. The more you play, the better you get. So, how do you implement it, especially if walking is a challenge? Start small. Even 5 to 10 minutes of walking, a few times a day, is a fantastic start. Break it up. Don't feel you need to do one long walk. 3 10-minute walks are just as beneficial as one 30-minute walk. Walk at home. If going outside is difficult, walk around your living room, marching in place, or walking laps around your dining table. Use support. If needed, use a walking stick, walker, or hold onto furniture for support until your confidence and strength improve. Focus on your gait. Consciously try to take slightly longer steps, swing your arms gently, and look ahead. You'll be surprised how quickly your stamina improves, how much less effort each step requires, and how much more confidence you gain. This habit doesn't just help your walking, it keeps you active, independent, and enjoying the world around you for years to come. Tip number 7. Listen to your body and seek professional advice. Finally, and this is a crucial point for all seniors experiencing walking difficulties, listen to your body and don't hesitate to seek professional advice. Here's the thing, while these tips are powerful, they are general guidelines. Every individual is unique, and sometimes persistent pain, increasing difficulty with walking, or frequent falls signal an underlying issue that requires medical attention. Ignoring these signs can lead to worsening conditions or more serious injuries. It's like trying to fix a complex plumbing issue without calling a plumber. You might make things worse. So, what should you do? Pay attention to pain. If a stretch or exercise causes sharp pain, stop immediately. Mild discomfort or a stretch sensation is normal, but sharp pain is a warning sign. Consult your GP. Doctor, discuss any new or worsening walking difficulties, joint pain, or balance issues. Your doctor can assess your overall health, rule out underlying medical conditions like nerve issues, arthritis, or circulatory problems, and ensure these exercises are safe for you. Consider a physiotherapist/physical therapist. These professionals are experts in movement. They can accurately diagnose the specific causes of your walking difficulties, create a personalized exercise and stretching program tailored to your needs and limitations, and provide hands-on techniques to improve your mobility. Podiatrist. If foot pain or deformities are impacting your walking, a podiatrist can help with custom orthotics or specific footwear advice. Taking a proactive approach with your healthcare team ensures you get the most effective and safest path to moving freely again. You'll be surprised how much peace of mind and progress you can achieve with personalized guidance. This habit ensures your mobility is supported by expert care, keeping you on your feet and enjoying life. So, there you have it. 7 powerful strategies, starting with a crucial stretch, to help you overcome walking difficulties and move freely after 60. We've covered everything from targeting hip flexors, strengthening your core, practicing balance daily, choosing proper footwear, staying hydrated, integrating regular walking, and crucially, listening to your body and seeking professional advice. These actionable, scientifically grounded strategies can truly transform your mobility and confidence. Imagine enjoying morning strolls with ease, keeping up with your grandkids without a second thought, and feeling stable and strong on your feet for years to come. Don't let walking struggles limit your life or your independence. You have the power to make a profound difference in your ability to move freely and confidently. If you found this video helpful, please give it a big thumbs up, subscribe to the channel, and hit that notification bell so you don't miss out on more valuable content. And tell us in the comments below, what's one new habit or stretch you're going to try starting today to improve your walking? We love hearing from you. This is part 7 of our Health After 60 series. Check parts 1 through 6 here. Next week, I'm sharing 3 surprising secrets to boosting your energy levels naturally after 65. You absolutely don't want to miss it. See you then.